My name is Asmara, and I'm a certified nurse midwife. I am an assistant clinical professor at UCSF, and I practice clinically at San Francisco General Hospital, where I provide prenatal care from beginning to end of pregnancy. I catch babies there, and I provide postpartum care for families in San Francisco. And I have the pleasure of being here moderating this conversation with my dear friend and colleague, Dr. Marta Tesfalul, who will be introducing herself now.
Great. Thank you, Asmara, and thank you to Habesha Health for giving me the opportunity to be here today. As Asmara mentioned, my name is Dr. Marta Tesfalul, and I'm a board-certified OBGYN and recently completed a 3-year clinical fellowship in maternal fetal medicine so that I can provide specialty pregnancy care to patients who have increased risk in their pregnancy. I received my undergraduate degree from Harvard in sociology, my MD from Johns Hopkins School of Medicine, and did all of my clinical training at the University of California, San Francisco, or we like to joke it stands for You Can Stay Forever. And I will actually be staying on to start as an assistant professor in the fall. Clinically, I spend the majority of my time with patients who are pregnant, delivering, or immediately postpartum. However, a very critical part of my time will be spent seeing patients pre-conception, that is before they even become pregnant. And that is if they have certain risk factors that put them at increased risk during their pregnancy. For example, chronic conditions like lupus or a history of a prior pregnancy complication. Having these conversations early allows my patients to optimize their health and prepare for pregnancy in critical ways. But we also know that among low-risk individuals that this information can be really helpful. And I think it's really beautiful to have this space to talk directly within our community about things that we could be doing to improve our outcomes. And I just want to acknowledge that in this space, I'm not here as your doctor. My hope is that all of you guys have primary care providers or OBGYNs or other individuals that you see for your care. So this isn't direct medical advice, but really just a sharing of information that will hopefully make everyone who's on this call feel empowered to be as ready for pregnancy as possible, acknowledging that there's so much that we can't control about the whole process. Yeah, and so with that, we'll just jump into a conversation.
Thank you, Martha. And that's so right. This is not a clinical consult, but we do hope to share this space as an added value to our community as a whole that we hope that each of you feel a part of. So please go ahead and ask questions, low stake environment where we can share information and grow together. We will start with a few topics that often come up for patients and friends and family, and then we'll go ahead and jump into answering questions that come up. And so let's get started. So we know that in the United States, specifically, about half of pregnancies are unplanned and many go smoothly. So Martha, why do we need time to prepare for this?
Yeah, that's a great point. And one thing I want to emphasize is that unplanned pregnancies don't mean that they're unsafe. And oftentimes they come as a welcome surprise. But we know that there are things that we can do in advance that increase the chance of having a positive pregnancy journey and outcome. Pregnancy is this very unique time where you're developing a new life, and a lot of the sort of foundation of that development happens very early in pregnancy with regards to development of organs like the heart and what we call the neural tube, or what goes on to become the brain and the spinal cord. And these things can start forming even before many women recognize that they're pregnant. So being in sort of in your optimal state of health, before you even recognize that you're pregnant, increases the chance that all of those processes go smoothly. I also talk to patients about how pregnancy is really like a stress test for your body, in the sense that it puts a lot of demand on your organs, on your mental health, and being in sort of the optimal state of mind and physically being in the right place can really help you withstand that increased demand that lasts for many months, and even in the postpartum period, there's quite a bit of demand. I mentioned before that a lot of the patients that I see before they get pregnant have certain risk factors, and so particularly for individuals who have chronic conditions or perhaps had treatment in the past for things like cancer that might impact what their pregnancy journey might look like. It's particularly important to prepare. As a sort of direct example, for patients with diabetes, we know that if their blood sugar is not well controlled very early in pregnancy, it can increase the risk many-fold for having major heart defects that are not reversible. And so, we do in our clinical settings sometimes admit patients really early in pregnancy for many days to get their blood sugar in control, to try to avoid those negative consequences. But if we can actually have their blood sugars controlled even before they become pregnant, that's better and safer. And so I think that that's just one example. And one thing I want to say is that we'll be talking a lot today about preparing from the maternal health perspective, just because that is such a unique most of the demand is on the mother who's carrying the pregnancy, and you have so much influence over the well-being of that pregnancy, and obviously it has huge implications for your own health. But everyone's who might be involved with the pregnancy has their health is important too. We know that fathers who are not in good health, that can impact their sperm quality and production and impact how long it takes to get pregnant. And we also know that if they're not in good health, for example, if they have maybe challenges around alcohol use, that can impact the environment in which that pregnancy is experienced and that child is eventually raised. So making sure that your partner or for the partners who are on this call, that you are also in good health is important. And then also the community in general. For example, if you have family members that you live with who use cigarettes, that secondhand smoke can actually cause complications during pregnancy. And so encouraging, those around you to be in their optimal health and when you're thinking about planning is important too.
Thank you, Martha. There's a lot there, and I just kind of want to just circle back and highlight some pieces, like this piece around talking about pregnancy being a stress test is so real. So if we often think about where our bodies go through a lifespan, at the end of our lives, we tend to have more wear and tear in the way our bodies carry out our optimal health, and so we see certain conditions start to rise then, and pregnancy kind of gives us like a window into that future, what that could look like, because there's such high demands in the pregnancy. So this piece around being in like the best optimal health we can be in is so important. And oftentimes we learn about that through pregnancy, but so beautiful to plan prior to. I really appreciate you highlighting this piece about different conditions that can be present and diagnosing them and treating them prior to pregnancy. As a midwife, I'm an expert in normal physiological birth and low risk pregnancies, but oftentimes when folks come in to get care, it's the first time they're actually getting care in years because of barriers to access to healthcare. So unfortunately, that is the case, and thankfully, we have teams that provide wraparound care, and we can co-manage care for folks that have more complex chronic healthcare conditions. But ideally, getting these healthcare needs met prior to the pregnancy is ideal. And so what are ways that we can ensure that we are in our ideal health, Martha?
Yeah, so I think one thing that I already alluded to is my hope that everyone has a primary provider, whether it's a physician or a nurse practitioner that you see on a regular basis, maybe even more frequently if you have chronic conditions that they're helping you manage. I think, one thing that should be happening or is hopefully happening every time you go see your provider is that they're checking your blood pressure and checking your weight. Those are two things that are really important as you're going into pregnancy. We know that high blood pressure or hypertension is associated with many risks inside and outside of pregnancy. And having your blood pressure well controlled before you become pregnant is really important for your overall health, but also being aware if you have hypertension can impact interventions that we offer you in pregnancy. For example, I'm a big fan of aspirin for decreasing the risk of preeclampsia, this condition that can happen in pregnancy where you can have dangerously high blood pressures and signs of organ dysfunction because of this issue. And aspirin can decrease that risk in patients with risk factors like hypertension. So being aware of that diagnosis before pregnancy is important because blood pressure fluctuates early in pregnancy and it can be hard for us to detect it once you become pregnant. I think the other thing about weight, or that I want to mention about weight, is that being underweight or overweight can have risks are associated with risks in pregnancy. So working with your provider to find out kind of what is the optimal healthy weight for you is valuable. It doesn't mean you have to wait till you get to your target weight to try to get pregnant, but getting closer to that as you're preparing or even as you're trying can help decrease the risk of complications. For example, the risk of diabetes in pregnancy if you're overweight, which is something that can have consequences on the development of the baby. I think in addition to blood pressure and weight assessments in the chat, I'm just going to put a link to some information about sort of general health screening that should be done at your with your provider, and it can sometimes be helpful to remind us. I think it's important to be empowered to know what things to expect your provider to be doing. If they're not seeing a lot of female patients, maybe it'll slip their mind that you're due for a pap smear. But knowing about diagnosis like precancerous or cancerous cells on the cervix before you become pregnant and getting treatment for that is much better than finding out in pregnancy. I've definitely been with patients who are getting new diagnoses during pregnancy, and that can be quite stressful because it can impact what treatments seem safe. Sometimes there can be decisions that have to be made about delaying care or delivering early. Those can be very, very emotional and hard. So knowing about the things that might be impacting your health in advance is important. And I think along those lines, I think in our community, we don't often talk about the conditions that we have in our families. We don't necessarily like to talk about it. It's almost like maybe we're embarrassed, or it's like a sign of weakness, or maybe something's wrong with me, or we just don't want, our doctor to put it in our notes about our family history because of concerns about insurance. Or, I've had many conversations with family members about that, but actually letting your provider know if there are conditions that run in your family can allow them to offer you earlier screening for things like cancer or diabetes. And knowing about those things again before you become pregnant is really helpful. And along on the breast cancer tip, I just want to shout out that Dr. Tatiana Khalil did a really great talk on Habesha Health around breast cancer screening for those who haven't seen it. So I'd encourage you to check that out. I've had just more patients than I'd like with that diagnosis in particular recently. So I just want to mention that.
Thank you, Martha. And just to circle back around the importance around having like primary healthcare needs, getting screenings as soon as you can, keeping up with them so that you have optimal health control and maintenance before entering the pregnancy is really key here, to be able to enter the pregnancy in a place where there's informed decisions being made and plans that decrease the amount of stress and unknown factors during the pregnancy. And with that being said, I think we often think about it separately, but me and you are really big believers and advocates around mental health, which is critical in pregnancy and overall our healths in general. And I'm wondering if you know factors that can influence preparing for pregnancy around mental health.
Yeah, I mean, I think as you mentioned, mental health is part of your overall health. And I think I was listening to a podcast recently that talked about sort of, our emotions can impact our body chemistry, right? We can sort of feel the toll that sometimes holding anxiety and depression, especially in this past year and a half now of the pandemic, that it can really change our chemistry, change our bodies, and that can impact pregnancy and it can impact your overall well-being. And that's part of the reason why that we in the medical field sometimes offer medications to help improve or promote healthier, more sustainable sort of body chemistry. And I'll just say, trying to become pregnant and then actually being pregnant can come with a lot of stress. And that can worsen or even lead to mood disorders. And if those are things that are already true for you before you become pregnant, working with your provider to come up with strategies, be it medication or therapy or some combination of the two, to cope throughout the pregnancy can be incredibly helpful. We know that there can be increased risks of mood disorders or mental health conditions like bipolar disorder in pregnancy, particularly in the postpartum window is where we worry about things like postpartum depression or psychosis that can occur because you're not getting sleep and you have all these new demands and you're adjusting to, this new life that now is with you. And so just making sure that if there are sort of things that you're working through, that you have somebody that you talk to and come up with strategies before you become pregnant. And then of course, during pregnancy, we follow people very closely and make sure to check in on your mood, but just recognizing that that's not a sign of weakness or your inability to be a good parent. We have lots of really great parents who just unfortunately have that extra challenge of dealing with a mood disorder on top of things. And so just want to encourage people to make sure that is something that you also take on as like an important part of preparing.
Thank you. And I just really appreciate you highlighting the fact that these conditions do take place throughout our lives and in pregnancy. And in society, we often have a socialization and to not talk about them. And there's stigmas around them. And I just hope we all know that we're all on the spectrum of health, right? And specifically around mental health. And so we are part of a team and we'd love to continue the discussion and provide support so that families can thrive and carry on with their pregnancies and their family well-being afterwards, which means centering the people caring for the new baby, the pregnancy. So please feel free to reach out to providers and have these discussions that can seem difficult if we haven't had them in our day-to-day conversations, but really can make a change in our fertility and our pregnancies and postpartum period. You did mention that some folks utilize medications, Martha, and starting on medications can be optimal for folks' mental well-being. And there's a lot of other conditions that require use of medications. So I'm just curious if you can share with us, what are some changes that we should be considering for medications during pregnancy or trying to get pregnant?
Yeah. I think one thing I want to emphasize from the get-go is that you really should talk with your provider before adjusting or stopping any prescribed medications. Sometimes it's appropriate and they will help guide you through, stopping those medications, but there's also a chance that you could be on medications that are safe to continue while you're pregnant, and may not put your pregnancy or health at, and it could be harmful to stop. I think one thing that's really important whenever you see your provider is just to confirm all the medications and supplements that you're on and make sure that you understand kind of why you're on different things and what the sort of anticipated length of time that you'll need to be on those medications for. Even over-counter medications. I think that there are a lot of supplements that are on the market that have that advertise a lot of benefits. But one thing to keep in mind is that supplements don't go through the same process of screening for safety or efficacy as medications. And that's not to say that they don't have benefit. And we'll talk a little bit about supplements that can be beneficial to take in a little bit. But it's important for your provider to know, because again, they can impact your chemistry and there are some that are not ideal in pregnancy. I think the other thing that's important to know is if you're planning on getting pregnant is what medications and supplements are safe in pregnancy. And I'm gonna again post something in the chat now. It's a link to a resource called Mothers to Baby. I make no money or commission off of working with them, but I love this site and this organization. They have a lot of different fact sheets available about medications, common ones that are available over the counter, but even a lot of specific sort of medications for epilepsy or for certain cancers, and it can be really helpful. And if there's a medication or a supplement that they don't have a fact sheet on, but you're interested in getting more information, you can submit a request or call them, and they actually have people who will look into the literature and try to find information so that you can feel more informed to have those conversations with your provider about whether or not to stay on it. And I think working with your provider about the best strategy around medications is important. In some cases, it's appropriate to completely stop or switch to a different medication that's safer in pregnancy. In other cases, there are medications that are not ideal in pregnancy, but are so important for your overall health that we really want you to stay on it as long as possible, and only to stop it when you have a positive pregnancy test. So that way, in the months where you're trying to get pregnant, you're still getting the benefit of that medicine. But then when you're pregnant, you're decreasing the risk that that medication impacts the development of the baby. And so there's not kind of a one size fits all strategy around medication use prior to pregnancy. It really has to be individualized to the patient and individualized to the medication that's in question.
And are there specific tests or treatments that people should ideally have done before they start their pregnancy?
Yeah, that's a great question. I think that there are certain, I don't know, I'm just taking, there are certain treatments. I guess one thing that came to mind is vaccinations. There are some vaccines that have a live virus in them, and so we don't recommend them during pregnancy, but being immune before you become pregnant is important because those infections can cause serious complications. Specifically, I'm thinking of chickenpox and measles. So those are things that are quite contagious, and I've had patients go to weddings where somebody's had it and they've not been, sure about their immune status. And because you can't get it once you become pregnant, it's helpful to know if you are immune, and if not, to get that before you become pregnant. I also want to highlight getting the COVID-19 vaccine is recommended for individuals who are thinking about becoming pregnant. in part because we know that having COVID-19 infection in pregnancy is quite, can be associated with a lot of serious complications and even an increased risk of mortality in pregnancy. And so getting vaccinated and being immune before you become pregnant helps decrease the chance that you have to deal with the illness when you are pregnant. And there were some rumors early on during the pandemic that perhaps the vaccines might cause infertility or cause increased risk of miscarriage, but there have been many people who've gotten the vaccine, and the CDC is tracking outcomes, including miscarriage and those sorts of things. And there's no evidence to suggest that it increases the risk of pregnancy complications to have the vaccine. And we don't think that there's any evidence that would support it being harmful to one's overall health. In fact, the American Society for Reproductive Medicine, which is where it's like the leading organization of individuals who help patients get pregnant with reproductive technologies like in vitro fertilization, recommend that their patients get this vaccine unless they have some medical contraindication to receiving it. I think the other thing I'll just say with regards to test, of course, you want to make sure that you have the tests that are recommended based on your overall health, the things that are listed in the Women's Preventative Services Initiative checklist. But I think that sorry, I just saw a question in the chat, so we'll get to that. But I do also think that there are some individuals are interested in finding out about the risk of certain genetic conditions, and for all pregnant patients and even those who are considering getting pregnant, we do encourage or recommend offering screening to determine if they're carriers for possibly passing down cystic fibrosis, something called spinal muscular atrophy, and then screened for hemoglobinopathies like sickle cell trait to understand if their offspring might be at increased risk. And so you can talk with your provider if you're interested in getting that testing before you become pregnant. Sometimes that can be a little tricky with insurance. They're really good about covering those tests once you become pregnant, but sometimes having those conversations in advance or getting carrier screening for other genetic conditions can be helpful. Yeah, so those are kind of, the things I would think about with regard to testing and treatments before pregnancy.
Thank you so much, Martha. And for those questions that are being posed, we will try to answer them within our discussion, but also shortly after Q&A, we'll compile them all and answer them there too. Thank you so much for sharing those questions with us now. I do want to circle back. You were talking a little bit about the supplements, and we touch on folic acid, and just which then ties us into nutrition overall. And one question I often get from patients is whether it is okay for them to continue their general multivitamins during the pregnancy. And I often talk about the difference is not only folic acid, but there's other vitamins and minerals that are different in the prenatal vitamins versus the multivitamins, and encourage them to make that switch. What do you emphasize about nutritional supplements and nutrition more generally?
Yeah, I think that's a great point around sort of, prenatal vitamins are going to have the right amount of folic acid and other things like iron, which you need more of when you are pregnant, and it's helpful to get your stores up even while you're trying. So I will tell patients who are not already taking a regular vitamin to start a prenatal vitamin at least ideally a month before trying to get pregnant, just to decrease the chance of there being a birth defect related to having low folic acid levels. And I do want to acknowledge that, again, not planning for pregnancy or not being on a prenatal vitamin is not bad. The majority of patients will go on to have a baby that doesn't have a birth defect. But when those birth defects happen, and major birth defects impact about 2 to 3% of pregnancies. Um, Oftentimes, families find themselves questioning, could I have done anything differently to decrease that risk? And rather than it being something where it's it was something that could have been done that wasn't, we want to encourage things that are going to allow you to kind of avoid those kinds of questions. If there was to be an issue with a birth defect, but you know that you were taking the supplements that you were supposed to be on, then that can sometimes help relieve any sort of sense of guilt or stress around that. But again, not saying that it's a bad thing if you got pregnant and you hadn't been on a prenatal vitamin. Just start it when you find out that you are, or that, the earliest possible. I think that, the other folic acid is obviously a big thing. I sort of alluded to the fact that it helps decrease the risk of neural tube defects like spina bifida. And the recommendation is that for reproductive age women, even if you're not planning on becoming pregnant, to be on 400 micrograms a day. And that's challenging amount to get just by diet alone, which is why we recommend the supplements. Iron, of course, is important. And there are other vitamins which and minerals and supplements, which we'll put in the blog post. I think it'll be a lot to go through it kind of right now, but might be helpful to check out in case you're interested about vitamin 12, B12, or other things along those lines. Or if you're on a particular diet, like if you're on a vegan diet, sometimes it can be really helpful to take certain supplements of vitamins that are typically found in animal-based products. The one thing I'll just add is that, just because they're vitamins or supplements doesn't mean that it's better to take more. So there are certain vitamins like the vitamins A, D, E, and K that are what we call fat soluble. So if you take a lot of it rather than your body just releasing it in the urine or getting to healthier levels, you actually hold on to it and can get toxicity from it. And vitamin A in particular at high levels can cause birth defects. And so you don't want to sort of like start taking extra vitamins, more than the recommended amount. And that's also true for things like zinc, which if you take too much of it, I think it can cause like copper deficiency. So you just want to make sure that you're kind of taking the recommended daily amount, because those supplements can be dangerous, especially if they're gummy and taste good. So don't have them like candy.
Yeah, that's so important. And kind of back to the point of like the multivitamin does have higher levels of vitamin A, where in the prenatal vitamins there's lower. So the prenatal vitamins are nice because they're kind of balanced in the way to complement our diets, which are so important to our nutritional intake of foods from a healthy, balanced diet is really important with the added supplement. And of course, like just supplements and nutrition that we eat aren't the only things we do consume. And so, for example, there's some questions that have come up around utilizing alcohol or other substances, and folks being concerned that this is going to impact their current pregnancies. They started using them before they knew they were pregnant. And so just curious to know what your approach is with that information at hand. It's someone's pregnancy or about to become pregnant or are currently pregnant after using those substances.
I think alcohol use in pregnancy, unfortunately, is the leading cause of or one of the leading causes of preventable birth defects and developmental delay. And outside of pregnancy, we know that it can increase the risk of many health conditions, especially if you're having it in high amounts. I like to emphasize that the guidelines outside of pregnancy recommend that women have one or fewer drinks a day, and that once you become pregnant, that to really not drink at all. And I think part of that is because it's unclear kind of what is if any level of alcohol is safe in pregnancy. That said, many people do choose to have a drink here or there. And if that's something that you're thinking will be sort of your strategy, we often will discuss waiting until at least you're out of that first trimester, where a lot of those structures are developing in the fetus and are at highest risk of having a birth defect. But even the brain is one of those structures that develops, significantly throughout the pregnancy. And so alcohol use, even in the third trimester, can have impacts. And so that said, when you're trying to get pregnant, again, that you can, the recommendations are 1 or fewer drinks per day. Some people will choose to not drink at all while trying to get pregnant, and that's safer for your overall health too, just because of those consequences that we know can come with drinking. But if you do choose to drink, one strategy that can be helpful or to think about is to consider abstaining. If your hope is to not drink alcohol during pregnancy, that you can abstain when you think that you're ovulating or when your body's releasing an egg. And we'll talk a little bit about how to anticipate that, and then wait until you get your period. And if you have your period, then okay, well, I'm not pregnant this cycle, so I can go back to having an occasional glass of wine. But then if you do find out you're pregnant, then you haven't had any chance of having alcohol exposure to that pregnancy. So just putting that out there as a possible strategy. I think the other substances that we often talk about, tobacco, we recommend everyone stop, pregnant, not pregnant, man, female. So that is something that we would encourage. And that's very true for those who are trying to get pregnant, because it can impact your fertility. And then even if you do become pregnant, and smoking can increase your risk of having something called an ectopic pregnancy, where the pregnancy actually implants in the tube or in the abdomen, somewhere outside of the uterus. And that can be life-threatening. And so you can decrease that risk by not smoking. Other illicit substances like cocaine or heroin or meth, obviously we recommend not being on for personal, health and pregnancy risks that are associated with it. And I'll just touch on, I think caffeine is another thing that comes up a lot. We all love our boon and our shahi. And the recommendation is in pregnancy to have less than 200 milligrams per day, which is like, about 3 shots of espresso, less than that a day. And you can definitely wait until you become pregnant to cut back, but some people can have withdrawal symptoms, and dealing with withdrawal symptoms and morning sickness is not fun, from what I've seen for patients. And so some people will take the strategy of starting to cut back as they're trying to become pregnant, just so they don't have to cut cold turkey or make any big changes before they conceive. And similarly, there are certain foods that we recommend not eating during pregnancy, like raw fish or meats, things like kitfo we would recommend against, just because of the increased risk of infections that pregnant patients are more susceptible for, which you can consider whether or not to make those changes before you become pregnant. And fish in particular can have mercury in it. So I can include a link about just like which fish which are a great source of omega-3s and other healthy things, which of them have lower amounts of mercury, so that you can optimize for that, because mercury does kind of stay in your body for a while. So when you're preparing for pregnancy, you do want to sort of be mindful about not eating too much, or the fish that are going to have higher quantities of that.
Thank you, Martha. And you're referencing the links provided here. All of them will be accessible on the blog. So folks, in case we don't get them here, just check out the website after, and they will be available there. Okay, we've gone through a lot. So thank you for your time. And I just kind of want to circle back to okay, so folks have paid attention to their medical history, their family history, what their intake is nutritionally, vitamin, medication-wise, and they're like, okay, let's do this. I'm ready to really move on to that level of trying to conceive at this point in time. And I'm just hoping you can share, like, what are those pieces of information that are crucial in that time frame of conception that can support folks in optimizing that time frame and the success of a pregnancy.
Yeah. So I think one thing that will need to be addressed is if you're on some form of birth control, kind of when to stop it is a question that comes up. And the IUD and birth control pills, patch and ring, you can have the IUD removed. You can stop taking those pills or using those other forms of birth control, and there's no need for like a cleanse or washout period. And a lot of people actually with those particular methods, like at the point where they stop it, their next cycle is actually one where they're more likely to get pregnant. So that can be a helpful thing to kind of plan around. I do like to acknowledge that Depo-Provera, which is the injectable form of contraception that's given every 3 months, and then Explanon, which is a rod that you might, and if you have it, but it's one that gets placed in the arm. When you stop the Depo shot or when you have the Nexplanon removed, some people's return to fertility is quite fast, but for some people it can take some time. With Depo, there are even reports of it taking a year before people's cycles come back and they're ovulating and have the chance to get pregnant. So if you're using those methods and you're thinking that you might want to get pregnant soon, it might be helpful to talk to your provider about transitioning to another form of contraception, just so that you're not kind of in this window where you're ready or you want to start trying, but you happen to be one of those people that it takes a little bit longer for your ovaries to start releasing eggs. So just putting that out there as you're making plans around birth control. I think I'll just share my screen really quickly for those who are looking. There is, with every cycle, there's about a 6-day period in which you can become pregnant, which we often refer to as the fertility window. And how we come up with that sort of like 6-day number is the fact that an egg, once it gets released from the ovary, can really only survive about 24 hours. And if it doesn't get fertilized within that window, it unfortunately will die. And so but sperm, on the other hand, can last up to 5 days. And so if you have intercourse or sex 5 days before you ovulate, there's a chance that some of that sperm will be able to meet that egg. And then obviously for that 24 hours after, so that's like 5 + 1 equals a 6-day window. And ideally, during that 6-day window, we see couples having the highest rates of conception if they're having intercourse at least if they're having sex at least every other day, but you can have it every day. Sometimes people think that, oh, maybe it's bad for if you have sex too often, but there's not signs that it decreases the chance of getting pregnant if you have it more often than that, but at least every other day during this window can increase the chance of becoming pregnant. And the one big question that often comes up is, how do I know when I'm ovulating? There are ovulation kits that you can buy over the counter, but one strategy that is cheaper is to actually track your cycles. There are a lot of different period trackers that you can download onto your phone. You can also keep track on your calendar. But if you can predict when your next period is going to be or start with those trackers or with a calendar, typically you're going to ovulate 2 weeks before your next period is set to start. So you can count backwards to that day. That will be kind of the estimated day that you would ovulate. So you want to try to have intercourse a couple days before that and a couple days after that, because our bodies don't work on a timer, or so sometimes it's not exactly that day that you'll ovulate, but if you're having intercourse around that time, that fertile window, then that can increase the chance that you become pregnant. So I'll stop sharing my screen. Um, and one thing that we acknowledged earlier on the call is that it can be quite challenging to try to get pregnant. I have this other graphic that I'll just share that highlights that, even with all this preparation, it can often take some time to become pregnant. About 20% of couples will conceive with that first cycle, and then by 6 months, about 70%. But for 10 to 15% of couples, even after a year of trying, sometimes they're still not able to get pregnant. And so, for our technical definitions of infertility for women who are less than 35 years old is waiting a year trying to have timed intercourse and not being able to get pregnant. And for women who are older, 35 years or older, we wait until 6 months and then actually try to get them in for assistance or evaluation at that mark, just because we know that fertility does decrease with age. And so if there is something that we can do to help support your ability to get pregnant, we want to be able to offer that sooner to try to optimize your chances. Now, that said, if you are somebody who doesn't have regular periods, or if you have had a prior procedure on your uterus, or you know that you have fibroids, or if you've had prior infections, that might increase the risk of your tubes being blocked, and want to know if that might be contributing. You don't necessarily have to wait a year or 6 months based on your age to get more information from your provider. It's very reasonable to have conversations before that point. You might not meet the criteria for being diagnosed with infertility, but that doesn't mean that there aren't things or tests that we can offer or support that we can offer sooner. But I just like to share that 6 and 12-month mark, because I think sometimes people have a question about sort of, at what point should I consider IVF or something more along those lines. And then I'll just highlight, and we'll open up to questions. Sorry, I'm talking a lot, but I think, it's estimated that in about a third of infertility cases that we're not, able to determine what the cause is of the infertility. And then for the rest of the cases, it's about half and half, whether it's like male factor or female factor. I think a lot of times women really feel like it's something wrong with their bodies or themselves, but that's not what the data suggests to us. I think it's, it is, it can be very mixed what the driver is of that.
And just to add a kind of sensitive question, but something that is reality in our communities is that sometimes pregnancies do result and then don't continue beyond the first trimester or early second trimester. And I'm curious if you have some information around that to share with our communities, because it's often a conversation we don't have publicly, but it is a common occurrence.
Yeah, and I remember when I learned in medical school how frequently miscarriages happen, I was quite surprised. And it depends on sort of the data that you're looking at, but we typically say anywhere from 1 in 10 to 1 in 7 in some studies of pregnancies end in loss. And that is incredibly hard, because I think, when patients have that pregnancy, families have that first pregnancy test and it's positive, or if they, have an ultrasound and it seems like everything's okay, and then something happens, it can be really heartbreaking. It can feel like losing a child. And we, I always like to emphasize that in the majority of those cases, there wasn't really anything that could have been done differently to change the outcome. A large driver of pregnancies not continuing is that the DNA, the sort of like the chromosomes in the pregnancy were such that it wasn't it didn't have the right instructions to be able to continue normally, and for that reason, that's why the miscarriage happened. And for some couples, patients, that can be helpful information, but I also acknowledge sometimes that's not helpful to know, and that it's fine. We always want to encourage couples to grieve that loss. Many individuals who do have a miscarriage will go on to have a healthy pregnancy, and we, depending on kind of the circumstances around that and other health issues, we always, we try to work closely with our patients to try to get them that healthy pregnancy in the future.
Thank you. Wow, we've touched on so many topics around this. And with that being said, there's so much more to be talked about. And these are just very general suggestions or things to think about heading into a pregnancy, but just driving home the piece around really connecting with your healthcare provider so that you could have that individualized care moving forward into planning for your pregnancy is the ideal outcome that we're hoping for through this conversation, given the specificity around your individual health. But there was a question about how do you work on self-advocacy with your provider prior and during pregnancy, which is a great question.
Yeah, it is a great question. And I think part of it is what you're doing now of finding ways to learn more about being healthier, or through organizations like Habesha Health. There are also I'll include some of the links in the blog post, but a lot of the professional societies like the American College of OBGYNs has patient information around frequently asked questions, around miscarriage or infertility or pregnancy in general, that can be helpful to look at. So that way you can have questions prepared or have tests or things that you want to discuss with your provider. And I think that coming to those visits with information and questions can be really helpful because it can help guide the conversation. I think particularly with primary care providers, they just have so many things that they're trying to balance with regards to promoting, good health for their patients. And so I definitely would, and I don't know if I mentioned this before, but if you're thinking about becoming pregnant, let your provider know so that they can start, making plans around medications, but also, making sure that you're up to date on, all those things. Making sure that those lines of communication with your provider are open is important. I'll also say it can be helpful to have somebody go to the visit with you. I think it can be really hard, and I say this even as a patient, you sometimes have questions, but you forget. But if there's someone else in the room that you've already had a conversation with beforehand, and they can remind you of things that you wanted to talk about, or they might think of questions during the visit that they can ask, that can hopefully help you both walk out of the appointment feeling like things really made sense. I think it is, I do want to acknowledge there are a lot of challenges with the healthcare system. I think that there are a lot of providers, unfortunately, who mistreat patients, who don't listen to patients. I think also as a systems issue, we often don't get a lot of time with patients. Visits are, scheduled for 10, 15 minutes at a time. So it often takes a village in the sense that your provider is like one person who can help, but communities like Habesha Health, maybe your faith-based community, sometimes there are organizations that do a lot of community outreach related to health. Those can all be avenues to learn more and just feel more supported and becoming healthier. And that I think also kind of touches on one of the questions that came in through the chat about, if you don't have a healthcare provider, how can you still do things to help improve your well-being? And I think there are, fortunately, especially during the pandemic, I think people have really moved to using online call, that YouTube has like a lot of informational videos, and also things like workout classes or people who are teaching individuals how to cook healthier meals. All those kinds of things are available at our fingertips, and getting recommendations about those types of resources from friends that you trust and family that you trust, or from your healthcare provider, can be a helpful strategy. I don't know if Asmara, if you have any other thoughts. I know you do a lot of really amazing advocacy work, so I'd welcome your input.
Yeah, thank you, Martha. I think those are very important tips. And just the last piece around that, we've lived in our bodies our whole lives, and we are experts about what good care looks like, what being listened to means, and those pieces really influence the way we engage in healthcare. So as you are engaging with your healthcare provider, and you have this journal that you have all your questions, and you come with a friend or a doula, potentially someone that supports folks before, during, and after pregnancy, and advocacy. But if any of that doesn't feel right for you, healthcare is just like any other service that we get, that we pay for, or insurance covers, and you can shop around. You can get a second opinion so that you feel, so that you know and can confirm that the healthcare advice that you're getting it does meet your needs, or change providers in the time that it doesn't. So this is a beautiful place where, when you are thinking about pregnancy, really reaching out to your community, your friends and family, and hearing about their experiences and providers that they felt comfortable with, so that you have some guidance around how to navigate that, or questions that should come up. So I just want to name this piece around knowing ourselves and trusting our intuition too, as we engage in this process, as we are our own experts, and leading this care too in a team. So if you find yourself feeling uncomfortable or not getting questions answered, go ahead and trust that, and move forward in a direction to get the healthcare that does feel right for you. Again, as Martha mentioned, the healthcare system is very complex, and we hope that the care you are getting does feel right, but also knowing sometimes we do have to pivot and turn our care to the attention of others, where we feel safer and have our needs being met. And so just heading into the second question that came up during the chat, is around, and I think you answered it a bit too already, Martha, around like what happens when we don't have primary healthcare providers or insurance. So it specifically says, second question there was, there are some overweight healthy babies, even some of them without knowing they are pregnant. So basically, folks who don't get care potentially during their pregnancy and do end up having healthy outcomes, even if they are overweight. And if you have any thoughts around that.
Yeah, I think one thing that I hope is true in the cities from which you guys are watching this, whether it's watching it live or on the recording, is that there are often resources for patients who are uninsured or underinsured that sometimes can be challenging to get access to, or might have like long wait times. But it's worth finding out if there are free clinics or health programs. For example, in the Bay Area, we have Healthiest, which is can help provide some medical care to those who might have challenges getting insurance elsewhere. So want to encourage seeing if those things are available to you. Once you become pregnant, getting health insurance is it's available through the federal government if you are below a certain income. So again, I'm not an insurance expert, but I would encourage people to reach out to maybe people in their local community who are in the healthcare field, or organizations that are near them to try to get resources yeah, and then especially when you are pregnant, that should be more available, that there's greater access for individuals who are pregnant. And I want to say, yes, we have beautiful babies that even in situations that are riskier, in patients who maybe had diabetes, who's, I mentioned that there's an increased risk of heart defects, but those risks, even for patients with the highest, what we call hemoglobin A1C, or a marker of their glucose control, even if that's in, double the numbers that we want to, that their numbers to be, still the majority of those babies won't have a heart condition. It's just that risk is increased. And so I think that even in situations where patients haven't had the chance to prepare for pregnancy or haven't been able to access healthcare, my hope is always that everything is fine. And that is my hope for all of you guys on the call, that your pregnancies go smoothly. But my job is also to do as much as I can to help that be true for the families with which I'm working, and to make it more likely that it will be safe and that everything will go smoothly by optimizing their health. We can't always take away certain conditions. I can't lower the risk to zero for anyone, even patients who are normal weight. I acknowledge there's challenges around use of those types of terms, but even in patients who have no health issues, sometimes I do diagnose a birth defect on ultrasound, or they do develop preeclampsia. That still happens. So you can be doing everything right too, and still complications can come up. And also, even if things aren't perfect, you can still have the perfect baby in pregnancy. And so I think it's challenging. I don't know if I did a good job sort of, addressing that question, but yes, it is. That's why I want to emphasize, you don't have to wait till you get to a particular weight, or wait until you get, to a certain hemoglobin A1C target to try to get pregnant. But I think having information about what would make it safer, and then deciding with your partner, do we feel like now is a good time, or should I spend a little bit more time optimizing my health before I get pregnant, is just helpful information for you to have to make those the decisions that are right for your family.
And Martha, I just want to acknowledge the piece, like key pieces that you've mentioned are like information and safety. And I think just in general around like maternal fetal medicine provider to midwifery to just a family medicine doctor, collectively, our goal is to share information so that individuals and their loved ones can make informed decisions around their care and navigate their care. Whether or not folks access this kind of support during their pregnancies is sometimes an access issue, where that was named. Like sometimes it's hard to get access to healthcare providers, so I want to acknowledge that. But also sometimes folks make decisions on when they want to access care too. The biggest piece around having the access or engaging in care is being able to make informed decisions, so that someone can have that autonomy in supporting their pregnancy in the way they see it fit. So there's another question here. We talked about different perspectives, and there's a question saying, is there any male factors that impact the infertility process if the man has a known or unknown mental health issue?
Yeah, so I don't know that, I'm unfortunately not aware of like the data around whether having depression or anxiety can impact the man's ability to conceive. One thing that does come to mind is there are some medications that are really helpful for treatment of mood disorders that can impact like the drive, like for intercourse, like can impact libido, or can impact or cause something called erectile dysfunction, where there can be challenges around actually having intercourse because of as a side effect of the medication. And so sometimes when men or women experience those side effects, they can talk with their doctor about whether it's right for them to switch to something else that's less likely to have those consequences. There are certain mental health conditions that that we do tend to see run more often in families it's not kind of a 50% chance or anything like that. It's not a direct sort of like gene transfer for these mental health conditions, but there is a general like an increased risk compared to the general population. For example, if either the mother or father has schizophrenia, and there's a higher chance that children could have it, but the majority of children don't, that are born to these couples. But I don't know. I can try to look more into it, and then in the blog post share anything if there's a specific question that you have that you want me to answer more one-on-one. You can also send me a private message, and I can try to see if I can answer that.
Thank you, Martha. And we have about 2 more minutes. I just want to go through a couple of questions here. One was specifically around the condition vaginismus. If you can just share a brief blurb around that, and what kind of specialists would be best to utilize if someone has this condition. Is maternal fetal medicine the best specialist, or are there other providers that can provide care?
Yeah. So vaginismus is a condition where the muscle or pelvic floor kind of involuntarily or like without control reacts to like any touch or sensation, and we typically think about it like in the context of intercourse, like when someone's trying to have intercourse and maybe they have like a spasm or discomfort around that, and there can be that can also be true with like using a tampon, for example. Some people have a lot of challenges around that, even though they want to be able to insert something into the vagina. Their body has this reaction that doesn't allow for it. And there can be strategies around pelvic floor therapy or different medical treatments, things that can be trialed to see if that can help with those symptoms, and a lot of different strategies. That is something that is typically cared for with a gynecologist, and not specifically a maternal fetal medicine provider, because it's something that often takes longitudinal care, meaning that you would see that provider a couple of times. And in maternal fetal medicine specifically, when we see patients before they become pregnant, it's usually a one-time consult. Maybe we'll see them a couple times if we're making adjustments to their medications or things in anticipation of pregnancy, but we're not patient's primary provider outside of pregnancy. And so having a provider, a gynecologist, some people do specialize in pelvic pain or floor disorders. Those can be good people to see. There are some physical therapists also who can do things like biofeedback. There's a lot of different options, but I think it would be something where I'd recommend seeing a gynecologist, and if you're able to find one who has an interest or a specialty in that. I will say I do take care of patients who become pregnant with vaginismus, and one thing that we're always mindful of is helping prepare for the labor process if they're going to be trying for a vaginal delivery, because there can be a lot. One of the main ways that we help support women during the labor process is by checking their cervix, which does require an exam. And so thinking about strategies around delivery to help with that is something that we do work with our patients for once they are pregnant, but we're not the primary treating providers for vaginismus.
Thank you for that. And I'll just go ahead and answer one of the questions that came here for the purposes of time. There were some questions around birth and postpartum time periods that I just want to say, just for the purposes of this discussion, we're talking preconception. We are hoping that in the future we will have conversations to keep this going from before pregnancy, during pregnancy, and after. So just keep tabs on our website to see if those come out. But the one question that came here was around specific herbs and remedies being used specifically in the Habesha community around beliefs of fertility and so forth? And that's a great question. And usually your healthcare provider, whether it is a midwife, a physician, has a very specific list of herbs and remedies that are beneficial or contraindicated, like you shouldn't be taking during pregnancy, and at which points they are recommended or not recommended. And specifically that link that Martha provided around the website to double check items, which will be available on the blog post, is a very beautiful tool to type in any kind of supplement, herb, or remedy, and you will see the impacts that it has during pregnancy or lactation period. So that's a helpful site to utilize. So again, thank you all for being here. Wishing you a beautiful Sunday ahead. Thanks for sharing time and energy with us. And we look forward to sharing space again.
Yeah, and I'll just say if future questions come up, you can reach out to, I think, the Habesha Health Team's email on the website. But thank you for joining.